Let's talk about breast reduction. So I did a breast reduction for a patient in the hospital today who had been looking for 4 years for a plastic surgeon who would do her breast reduction for her through insurance. I agreed to do her surgery today because she'd been looking for so long and because I wanted to help her. She has good medical reasons to have a breast reduction. It's actually really clear that she's a good candidate for it based on the criteria that the insurance company proposes. Unfortunately, though, her insurance company only reimburses $1,000 for a breast reduction. She couldn't find anyone to do it. And I understand why. The average cost for a breast reduction in the United States is $7,800. That's just average. In Austin, I typically see like $9,000 to $13,000 for a breast reduction. I mean, it's a big surgery on a really important part of your body and you want a great result. So I think when you look at those numbers and the difference between $7,800 and $1,000, you start to see part of the problem in healthcare now. Here we have an insured person who has a condition that has a fix, right? We have a surgery we can perform, and there's not a shortage of surgeons to perform that, but we just can't find enough surgeons who will agree to perform those surgeries through insurance because the reimbursement is so low. I want to be able to offer breast reductions to my patients through insurance. I want to, but the costs of having a practice and inflation are ever increasing, and reimbursements as determined by Medicare are actually going down, and they have been going down for years. So what you're feeling when you try to find access to surgery and you can't find someone who's willing to do that surgery through insurance, that's real. And that's because a lot of surgeons like me, a lot of doctors like me simply can't afford anymore to accept the reimbursements that insurance companies are offering. It's just not fair. So it's going to take a lot of work for us to get past this, but without acknowledging how far off we are, we won't be able to start, right? So I guess I just want you to know that as a surgeon, I want to help. I don't want this to be about money. An insurance company makes it about money when they pay me so little that I lose money going into the operating room. I know we can do better, and I'm gonna fight for that. I just want you to understand, insurance doesn't mean access. Coverage doesn't mean access. Insurance companies have to pay doctors fairly in order for you to have access to the care that they can provide. The skyrocketing cost of healthcare is not because doctors are being overpaid. It's not, and there's plenty of studies to show that. It's really the administrative costs. I don't know where all of the money in healthcare is going, and insurance companies are making record profits. I am struggling to keep my practice open, and this is an example of why.